So I've been asked to answer whether cardiac rehabilitation is important. Oh, it's very important. It was so important that when I moved to Kelowna, I ensured that we actually had a program up and running and available for our patients. I'm very much dedicated to cardiac rehab because I know it works. There's been ample evidence over the years looking at patients after a cardiac event, whether it be a heart attack or a stent or bypass, and looking at how well they do. And we know that patients who participate in a cardiac rehabilitation program, they do better. They actually spend less time in hospital, they're less likely to have future cardiac events, they're more likely to be compliant or maintain their medications. And overall, patients who have cardiac rehabilitation, not only do they have better outcomes, but they feel better. And that's important. That's probably the most important thing. And why and how do they feel better after cardiac rehab? Well, it's a combination of things. It's not just the exercise. When we think of cardiac rehab, we think about getting on a treadmill, but and that's certainly important. And for that's still a really important mainstay of cardiac rehabilitation, getting someone fitter after a cardiac event, because not only fitness is important for longevity, but it's really important just to be able to maintain doing the things you want to do and enjoy, whether that be shopping, golfing, skiing, biking. Getting you back to those activities and getting you maybe to a higher level of activity is our goal. If we do that, then we're going to have more success with the next goal, which is trying to help patients deal with weight and diet. If we're exercising more, then we're going to have more success with that. But the cardiac rehab programs, most of them have dietitian involvement, will also help those patients who have struggled with weight. Is there anything else that you haven't tried that can be done? And most of the programs will help focus in on not only weight loss, but choosing a healthy diet and learning how to change eating habits that may have contributed to heart disease. Rehab programs will help patients who are struggling with smoking cessation, and that's really not an easy thing to do, and there's lots out there that can be done to help you, and having a supportive team around while you're going through that difficult time is really, really important. So smoking cessation is one of our big goals for patients who have had a cardiac event, because that really helps prevent them from being back in hospital. The cardiac rehab team, one nice thing is that they're around for a large period of time. When you see a family doc or a cardiologist, often the available time is not long enough to answer all the questions, and the questions may not come up at that point. And so being around a cardiac rehab team for a few months after event usually helps you answer all of those nagging little questions about your cardiac condition, about medications, about diet and exercise. And so having a bunch of educated people answer your questions, it helps me because you're a more educated patient, and generally the more you know about your condition, the better off we will both be. The rehab program also allows me an extra set of eyes after a cardiac event, because not everybody does perfect. There's some patients that do have some problems, and if there's a team looking at you on a day-to-day basis, I'm going to hear about it. If you're up here working out with the team, if you're having problems, I'm going to know about it, and I want to know about it. So it's important that you participate in cardiac rehab, because if there is an issue, I'm more likely to hear about it, and we're more likely to attend to those problems. Cardiac rehab teams also help deal with the psychosocial elements of cardiac disease. So many patients, they're either anxious or depressed after a cardiac event, and in many cases that anxiety and depression can be relieved or identified, and we can help manage those feelings. Cardiac rehab, I think, is really it's about setting you with a lifelong plan of how we're going to manage your heart health and your overall health. And while these programs are sometimes short, meaning weeks or months, the intention isn't for you to come in, do 2 weeks, and then forget it all. The intention is that this is a training program for the rest of your life. And patients who are able to do a few months in cardiac rehab and then keep it up, that's what we're aiming to achieve. Those sorts of patients who are able to maintain the things they learn in cardiac rehab, they're the ones that really do well. And I think those patients also have a lot of fun with the program and with the ongoing activities that they're participating in. So hopefully you'll find cardiac rehab not only educational, but hopefully you'll find it fun. I think most do.